and I'm going to be hosting this meeting today on behalf of Brasha and MRN. So let me give you a brief introduction about what's Brasha and MRN. So Brasha is a student-led organization in different fields, which helps the medical students not only in researches, but also in other fields, for example, in the residency or in the mental health or any other fields that may be helping in empowering the medical student skills. About the MRN, which we are having it today with us. So it's a monitoring research network which empowers all the researchers, and also it helps all the students to know more about the research and the basics of the research. And hopefully from this meeting today, you will get to know more about the research and you will be interested to know and be a good researchers in future, hopefully. And I would like all of you to welcome our speaker today, Dr. Mona, the Executive Director for MRN. And yes, I would like you to say today what you're gonna present for us. And I would like also to say something that we will be having, first of all, of course, Dr. Mona will be presenting for us today's topic. And after that, we will be having like 30 minutes of discussion. So feel free to write it in the chat box as well. After that, we will start discussing it. And also we will be sharing the feedback link, and hopefully everyone will be doing it so that we'll know how it was beneficial for you, all of you. Yes, Dr. Mona, please, you can start.
Thank you so much, Ala, for your kind introduction. And I'm really excited today to be presenting in collaboration with Prasha. The topic of today is advancing research through planetary health approach, harvesting low-hanging fruits for early career researchers. And you may ask yourself, who are early career researchers? Because you are included, it's typically within the first 10 years of completing the highest academic qualifications, whether it is the bachelor degree or even a PhD degree or equivalent. So graduate students are included, postgraduate researchers are included, junior faculty members and researchers in non-academic settings. All this is included in the initial phase of establishing the research profile. And I would like first to begin that roles and responsibilities are important, but then the passion really is something that drive all these kind of initiatives that I'm undertaking. For the objective of today, I would like first that we examine the current research landscape, and then to introduce the planetary health and its relevance for early career researcher, and then to foster transdisciplinary research for the pressing planetary challenges that we will elaborate about, and to address barriers and enablers or the low-hanging fruits to advance planetary health research for early career researchers. So regarding the agenda of today, well, we have sort of activities that would enable all participants attending today to be more engaged with us in this topic. I would like first to know your expectations. What do you think the whole mark of this webinar will be about? So please type in the chat box your expectations, and I hope that Ala can take it from there and share it with us by the end of this webinar. Then the first topic will be about the current research landscape and its relevance for early career researchers. We will have a reflection activity, and again, you will use the chat box to write all your ideas about it. And then we have discussion and case studies, poll, and then learning moments. And finally, we have a feedback form that I hope Ala will be pasting it in the chat box for all of you to share with us your valuable feedback. So first to begin, we would like to have a broader look at the current research landscape, its challenges and opportunities. So this is for you, the first activity, and you can use the chat box to share with all of us your ideas about why conducting scientific research matters to you on a personal level. Think for 1 minute and reflect for the next 5 minutes. Is it clear? I would like to know if there is anything that you can ask about, but then I'm really excited to read more from you and to keep you engaged while having this kind of conversation about research. Yeah, just give me a thumbs up so that I can proceed. Thank you. So, research in the age of the Anthropocene. This is the reality of the current research landscape. Actually, we are in a new geological era, which is called the Anthropocene. Anthro means the age of the man, where human beings are causing problems that can dramatically impact the Earth's natural systems on the whole level. And this is partially due to the technocentric models dominating modern society. And of course, we are all now seeing the magnitude of how AI has infiltrated into all fields of science and non-scientific even domains. So this is the way that we can also pay more attention that research in the age of Anthropocene differs from research before the 21st century. And to elaborate on the global health scenario, actually, we have a very important study that predicts that by 2060, the world regions with the age groups and health conditions, there will be like escalation of the global burden of serious health related sufferings. And also a Planetary Health Alliance, which is a consortium of more than 480 institutes and universities, they declared that the average global citizen's health has improved over the past century, yet the health of our planet has sharply declined, putting historically recent and fragile public health gains at risk. And this is really an important topic that we need to discuss, that it's not just about research, it's also about rethinking education, community values, the idea of innovation. Not every innovation is advancement. And the idea of healthcare and how everything now is really affected by the anthropogenic domain. So, from a medical perspective, I know most of you are medical students. It's very important that we draw parallels between the decline in environmental changes and the evolution of diseases, mainly non-communicable diseases, allergy, autoimmune diseases, mental health crisis, childhood obesity, hypertension, cancer, and cardiovascular diseases on the list. This highly accurate timeline was part of a presentation given by Professor Susan Prescott, who is a prominent immunologist, pediatrician, and planetary health scholar at the Nova Institute for Health in the US. Looking at this timeline, we'll find since the Industrial Revolution, 1875, fast forward to 2025, we can see how industrial revolution, the war of microbes, penicillin, and the antibiotics resistance to the large use of detergents, ultra processed food, biodiversity loss, technology, culture, and also disconnection from nature to the climate change era. How all of this is going in parallel with environmental changes at the macro and micro scale. So it's typically a crisis in slow motion till we are now seeing younger disease phenotypes, for example, even childhood obesity caused by inflammatory diseases at a very early age. So this is from a medical perspective, how the Anthropocene is affecting the healthcare scenario. From a humanitarian perspective, we need to be very realistic about what's going on last year and the year before. This paper is published in Environmental Health and is a call from 40 public health scientists for an end to the continuing humanitarian and environmental catastrophe in Gaza. It's again pointing to the age of man, the Anthropocene era. The ethical perspective of the role of public health institutions in the ethical reconstruction of Gaza and what's going on actually in the Middle East is something that we need also to focus on, because this was part of an event launched by London School of Hygiene and Tropical Medicine. So it's still related to the healthcare system, and for us as professionals in the healthcare, we should also have a kind of point of view when it comes to how humanitarian crises are central to the advancement of public health. It's very interesting that they invited the speaker, Francesca Albanese. Of course, you all heard of her and her strong views supporting the people of Palestine and what they need to flourish once again in their indigenous lands. This one is pretty alarming also because of the fund. The funding climate is now changing in a very fast pace. Since Trump execution and he's putting science, technology, engineering, and math, all this effort is put on hold. And it's a kind of dilemma for a lot of students who are engaged in grants and scholarships. Suddenly, all this has been put on hold. Um, so this cartoon even is reflecting on how a postdoctoral would think, like how an assistant professor would have other views, and even lay audience from Canada, for example, how the funding climate is affecting the academic career as a whole. So this is from a political perspective, and from an academic perspective. Actually, the core purpose of academia lies in the pursuit of knowledge for societal benefit. Yet this mission is under threat from escalating poly-crisis at the planetary level, which undermines socio-ecological conditions necessary for both education and human progress. So in this article, we can see the title, No Research on a Dead Planet, Preserving the Socio-Ecological Conditions for Academia. So in this article, they were arguing that the climate emergency is something that all universities and higher education as a whole should be focusing on. And there should be no paradox between what we are truly publishing in academia and what the current planetary emergency requires from us. So this is regarding the academic publications. Regarding another paper, actually, it's published in the Earth System Governance. It's a very new one this month in January, and it calls for a research partnership external to academia. And the title of this paper is What's Good Co-Production in the Context of Planetary Health Research, and How is it Enabled? So they argue in this article that there is an urgent need for research that can help address complex real-world problems such as global burden of non-communicable diseases, the climate and biodiversity crisis, and widening inequalities. The challenge, however, requires rapid mobilization of early career researchers and new research groups that are large in size, involve many diverse and disconnected disciplines, are based on co-production with a wide range of external stakeholders, and prioritize real-world impact. So here, this is again stressing on the urgent need to produce research that really mirror what's going on in the real world. So we would like to proceed with the next item of what's planetary health and how it can be a framework for systems-based and values-driven research. Now it's your role to discuss why modern global health challenges demand action-oriented solutions. Again, use the chat box to share with us all your ideas on why modern global health challenges as we mentioned, from a medical perspective, political perspective, academic perspective, and also humanitarian perspective. All these demands thought leaders and researchers to act with action-oriented solutions, not just to publish data and to publish for promotion. So it's a very critical time in the 21st century. Moving forward with what's Planetary Health Manifesto. Planetary health actually is achieving the high standards of global health, well-being, and equity through sustainable interactions between human systems, political, economic, and social, and the Earth's natural system. This was published in the Lancet Planetary Health in 2015, and it implies the interconnected cycles of environment, health, and governance together with transdisciplinary collaboration for planetary health. To say, in other words, it's unlike the traditional public health. Planetary health explicitly connects environmental degradation to health outcomes, framing solutions within systemic and holistic approaches. About the genesis of planetary health, actually, it's very important that we track the origin story of any cognitive frame that we are discussing. Interestingly, that growing global environmental movements and planetary consciousness started with the magnification of the NASA Apollo 11 mission with the Earthrise photograph in 1968. And perhaps even we can go back to early 60s and dig deeper into other thought leaders who raised awareness about the importance of planetary health, but a different language of it. So this marks the beginning of planetary health genesis with the famous picture of Earthrise. Later in 1970s, calls for integrating research and practice in a framework that recognizes the connections between individual, community, environmental, and planetary health were established. In the 1980s, acknowledgement that these ideas have been deeply embedded within indigenous knowledge for centuries. To harm the earth is to harm the self. And also here we should remember Ma'at principles that echoes how ancient Egyptian used to honor everything regarding nature, environment, and how this is echoed on health and well-being. In the 1990s, calls for planetary view that recognizes the interconnectedness of all life and that connection to nature is an essential part of the human, physical, emotional, and spiritual well-being. And the idea of spirituality in academia was actually completely abolished since the 1970s, actually, in all institutes, universities, and so on. But then planetary health, it magnifies the importance of spiritual well-being. And we'll find a number of papers published regarding this idea, the contribution of Islam to planetary health, for example, and so many other integrating religious worldviews into the planetary health paradigm. In the year 2000, coinage of the term the Anthropocene took the planetary health paradigm into a new level when it described large-scale impact of human activity on planetary systems as a whole. Developing models and discussions of planetary boundaries, which is safe operating space for humanity. But then I do not really like to resort to this idea of safe operating space for humanity because it limits the resources and it makes like the narrative apocalyptic and perhaps very negative in its views. The idea of planetary boundaries, yet it's adopted by many scholars in planetary health paradigm. In 2010, Global Health Summit in Beijing, China, 2013, articulated the future of well-being lies in the concept and policy of planetary health, subsequently articulated in The Lancet in 2014, with the year 2015 launch of the Rockefeller Foundation Lancet Commission of Planetary Health, with this published article on safeguarding human health in the Anthropocene epoch. Um, Yet, the Anthropocene also reminds us of anthropocentrism, all the human tendency to view the world through a unilateral Cartesian view as an inert object. And this is the problem now. And that's also a cause of all exploitation happening. In the year 2020, widespread interdisciplinary cross-sectional engagement in planetary health initiatives happened, and planetary health conferences, many of them fast forward to the Sao Paulo Declaration and also Kuala Lumpur roadmap, with the articulation of planetary health pledge. And that's very important. This pledge, which builds on Hippocratic oath, but then integrates calls for more attention to environmental factors affecting health. So, to sum up, planetary health can be defined as a movement as well. The Canmore Declaration on Planetary Health, articulated in Canada, requires improving the health of all systems, which depends on mutualistic values, planetary consciousness, advocacy, unity of purpose, recognition of the biopsychosocial interdependence, emotional bond between people and the land, efforts to counter elitism, and this is very important because of prestigious institutions taking over and dominance and capitalism. So efforts of planetary health is to counteract this kind of, if we can say, the neo-colonial institutions. Also form a meaningful cross-sectional and cross-cultural narrative to foster self-awareness and also a personal commitment to shaping new normative attitudes and behaviors. So the concept of planetary health was firmly established in the medical lexicon in 2015, and it implies that the totality of health should be viewed under this panel with calls for integrative ecological solutions to our global challenges spanning from the personal to the planetary health. To frame it in another way, planetary health is systems-based and values-driven approach. We can see here the intersection between different disciplines, natural science, health science, and arts and humanities, and maybe even much more. So while planetary health principles are newly recognized in Western academia, they have been central to indigenous worldviews for millennia, emphasizing the interconnectedness and interdependence of human and nature. Planetary Health Alliance underlined the need for massive collaboration across disciplines and national boundaries. The Rockefeller Foundation, and as we can see here, the Journal of the Lancet Planetary Health, they stress that substantial and urgent expansion of transdisciplinary research is very important frontier going forward. As I mentioned, spirituality and consciousness is an integral part of the planetary health movement or the planetary health approach. We have multiple initiatives supporting that. One of them is the Constellation Project, and it implies that the spiritual well-being is foundational to the overall human well-being. And we can see nowadays so many research linking between spirituality and the mitochondrial science. And this is very important as an energy powerhouse that's really affected by the pattern of the spiritual level. And since the late 1960s, Syed Hussein Nasr, he linked in his publication that the ecological crisis is actually based in a spiritual crisis. And this was far more advanced before all of the attention that took place later in the 21st century about the importance of spirituality for personal and planetary health. Of course, you all know about the Sustainable Development Goals, which should be achieved by 2030. Planetary health also tackle this through academies and institutions supporting this kind of sustainability culture. And this slide is very important because it gives an estimation that the population around the globe is actually in expansion regarding the planetary health paradigm, but also linking planetary health to other challenges as the climate change. So here we can see from the year 1995 to the year 2025, there are uprising publications. Many of them are published in the field of planetary health, but also in the field of planetary health and climate change. And this kind of context is very important and also give us an estimation about journals most probable for us to target if we want to write research in planetary health. So we have the top 10 most productive sources on planetary health, like Lancet Planetary Health Journal, with an impact factor of 25.7, and Frontiers in Public Health, International Journal of Environmental Research and Public Health, Medical Teacher, so people interested in medical education can tackle planetary health, and the list goes on. But then, of course, for increasing citation, all eyes goes on the impact factor, which is an important criterion in publication. Now, this map is also very interesting because it gives us an estimation about the intensity of published work regarding country level. So the size of black circles represent the output of each country. The larger the circle, the higher the performance of the country with respect to the number of publications. If you can reflect on this dots, you'll find that the US and Canada and Australia, they are on the top of the list, and then the intensity and the color is much fading when it comes to the global south countries and also in Africa. This kind of network visualization map also plots the international research collaboration among countries. The countries with the greatest total link strengths was selected, and here at the center again we'll find the United States, Canada, Australia, and the United Kingdom, and co-citations mainly between Denmark, Germany, Switzerland, Brazil, and so on. Interestingly, the top 10 funding sponsors on planetary health climate change nexus by percentage is more in the UK, United States, and European Union, Australia, and also Canada. But then the WHO comes last in the number of publications and the contribution to funding. Regarding this network visualization map, actually it plots more than 6,000 sources, and it draws connections to the total strength of co-citations with other sources. And this is important so that we'll see the top 10 journals and how the other journals are also important in citation process, and what are the type of documents even published. On this table, we will see framed review articles, which require little skills actually, because it's like secondary research. We'll find like from the top 20th, we'll have like more than 60% review articles, and this can have an impact at the end. Also here, we have a network visualization maps of the co-occurrence of titles and abstracts. We have the topic of climate change and planetary health. So to tackle all this, the cluster can be identified as the red cluster, 20 items, tackling the issue of curriculum and education among healthcare professionals and students. Cluster 2, which include 16 items in green, and is mainly concerned with the impact of climate change on biodiversity loss and ecosystem services and the link to infectious diseases. And cluster 3, which includes 11 items, and it deals with diet practices, food systems, and their impact towards sustainable development. Again, this gives you a taste on the trajectories on which regarding linking the bigger picture of planetary health with the pressing planetary system. Also, I would like to remarks to the Challenges Journal concerned with planetary health narrative. In this issue, it's about nurturing connected consciousness in the Anthropocene, addressing calls for cultural and spiritual transformation at the path to personal, collective, and planetary health. And I'm part of the editorial board here, so I would like to invite you whenever you have the opportunity to write an article to consider also the Challenges Journal, part of the MDBI Transdisciplinary International Journal. So the next item on the agenda is about highlighting opportunities and how this can foster transdisciplinary planetary health research. Now it's your turn with this case study or this activity, asking you, did you collaborate before with researchers outside the healthcare sector? Any common ground did you find? Again, use the chat box to share your ideas with us about your previous experiences collaborating with other researchers outside the healthcare sector. So essentially, planetary health is a holistic approach to life with the objective that all people on the globe enjoy health and well-being and leave no one behind. So we can consider how we lead ourselves and within organizations. We can do so through recognizing the power and agency we hold, both as leaders and stewards of this earth. Through changing discourses, choices, and practices, we can shift collective value systems, promote individual and planetary health from the grassroots or organizational levels upwards. From this perspective, we seek to protect our cultural diversity and traditional knowledge as means for advancing individual and collective health and well-being for people, place, and planet. This is just a summary of how we can view ourselves as stewards with a positive ripple effect. First, it starts on the personal level and your intuition, and then you take your organization with you to this holistic approach of planetary health. And this is our contribution to raising awareness about planetary health through education, narrative medicine, and planetary goals with the central idea of radiating positively towards caring of oneself and others. This elective course is given since 2017 in the integrated program of Qasr Al Aini Faculty of Medicine, Cairo University, and we try to act within our local context with local challenges and to address fundamental value system in a more meaningful way among our students, and also to mediate our narrative with robust scientific evidence to redefine human health and well-being at all scales. And to give you more examples about how we are implementing this idea, first we need to remind ourselves of how the interconnectedness go in a direct line from the cellular to the cosmic scale. And this is very important because our current curriculum in medicine is not really drawing all these connections, and life can be really in distress at the cellular level, which we interpret that as inflammation at the cellular level, but also there is inflammation at the planetary scale that we refer to as drivers of inflammation and dysbiosis by ultra-processed food, radiations from mobile phones, 5G, and so on, and also pollution, so many things that we will discuss later on in the slides going forward. So actually, this kind of interconnectedness from the cellular to the cosmic scale is something that foundational, that medical students try to always draw parallels on the idea of dysbiosis, life in distress, when it is at the cellular level, it's also because there is environmental or external factors affecting this kind of inflammation from the inside out. So academic silos is actually a very challenging thing in universities, especially in the faculty of medicine and the healthcare sector, because to move from the disease model to the idea of human flourishing is something that needs integration of so many disciplines grounded in epigenetics, spirituality, and the mitochondrial energy, clinical ecology, exposome science, microbiome science, and to measure all this with the omics revolution, like the proteomics, metabolomics, all this can really give an estimation to environmental factors, how it's affecting our inner biology. For us in medical schools, we are trained about neurology, anatomy, physiology. There is respiratory system, the gastrointestinal system. But then at the end, this is not really giving a full picture of how human flourishing and well-being should be like. So moving from disciplinary to transdisciplinary research is really something essential if we want to broaden our perspective and integrate planetary health into our thinking. Planetary health magnifies the molecular level interplay of many of the challenges causing multiple comorbidities in the healthcare system. For example, we have evidence-based medicine to treat depression, osteoporosis, musculoskeletal diseases, asthma, COPD, cardiovascular diseases, rheumatic diseases, diabetes, obesity, and the list goes on. But then when we see how the causes behind the causes are causing allostatic overload, anti-inflammatory cytokines, the interplay of oxidative stress, cortisol level, parasympathetic and the sympathetic. It's a big interplay happening, and all of this is under the umbrella of the allostatic overload. This kind of thinking, it brings us back that chronic stress can be a cause for all of these symptoms and diseases, sometimes labeled as chronic diseases. So planetary health magnify the molecular level interplay with future physicians miss when they try to treat comorbidities. Also, systems thinking help us to integrate the exposome science, which means that the human genome is really affected very early in life, even in utero, with the early immune programming, early metabolic programming, and environmental exposures, whether it is social stress, the level of education, industrial pollution, even physical activity, psychological assets, antibiotic use at a very early age, or even vitamin D deficiency, food diversity, calorie intake in processed food. The list is so broad. This kind of system thinking is really needed when we examine how we should approach the exposome perspective is very important when we deal with early life events and immune developing in a changing world. And this also may explain why early disease phenotypes are nowadays prominent. For example, even the childhood obesity, as we mentioned earlier. So here, this is some kind of reflection on the methodology we use in our educational approach. Again, we use a lot of activities, values. We try to integrate that as how to promote ideas of connectivity, to inject empathy in our practice, and also mindfulness. And this is very important also to teach medical students how to reflect on what's really happening in the healthcare system as a whole. Intergenerational assignments, as I can say, they really unleash the talents of students and the potentials. And the format can span from something like artwork to even research work writing. And This is very important because assignments sometimes can be in a very rigid way, just to have gradings and so on. But then, how about creativity? All this is not measured in the paradigm of medicine, which is sort of a hard science that need to be measured by critical thinking, problem solving. But then the creativity level is not really assessed. And the outcome, we hope the outcome of early career researchers taking this course is to align their planetary health research with global needs and to contribute to the systemic change and build the skills necessary for impactful career going forward. And here we can see a forum that took place Qasr Al Aini. It was about climate change and planetary health education. And we had with us Dr. Omnia Al Omrani. Even she started the planetary health when she was a medical student. And now she is the youth envoy of the COP27. She is really taking very critical and global positions to amplify what planetary health is going forward. So early career researcher mindset matters in the Anthropocene. By planetary health mind, we mean that we need to tackle multifaceted perspective, unconfined by traditional views and disciplines, and this needs flexible thinking. It requires new challenge of intellectual exploration. So creating new knowledge by interdisciplinary and multidisciplinary expert exchange is much needed, and mindset is very critical, and this depends on every researcher and the passion and intuition he has towards all these planetary emergencies. We need also to adopt relational thinking. Something else about medicine being a hard science with very technical frameworks, rigid frameworks, we need to adopt a kind of relational thinking. For example, here the 2022 sixth assessment report of Intergovernmental Panel on Climate Change described this as the inner transformation towards sustainability, where it addresses values and individual and collective mindset. And through this kind of approach, they aim to nurture connectivity by meditation and social practices and raise more awareness towards a wiser sustainability culture. To put it in other words, they need an inner development goals, not just sustainable development goals on a national or international level. The individual inner development goals is much needed, like relationship to self, cognitive skills, caring for others and the world, as well as social skills and how we act with a driving force to implement change in our sustainability culture. Another initiative that I would like to draw attention to is the Mentoring Research Network hosting this session actually. And again, I would like to acknowledge all stakeholders, all the members attending with us in this meeting. It's something really beautiful to see how we are evolving across time and space. And this is simply our members, our devoted and dedicated members who are from different disciplines. And this gives us an estimation that planetary health is doable when we meet with passion towards a certain mission. And the mission could be on personal level to advance in our career and our research productivity, but also to elevate our countries and our continental aspiration towards achieving sustainability and health for all. In the Mentoring Research Network, we are typically trying to move from sectorial to multi-sectorial collaboration through our multidisciplinarity, and also to value and honor ancestral knowledge. By ancestral knowledge, I mean the indigenous wisdom and our heritage. Even in India, Vandana Shiva, she's a very strong advocate for indigenous agriculture. Again, this is reflected on science when we integrate the microbiome science and how dietary interventions can really help health through promoting the diversity of healthy gut bacteria and so the human well-being as a whole. So this kind of promotion of traditional food, traditional medicine through the indigenous knowledge system is something that we advocate for in the MRN. We also promote the assets, the simple assets like positive emotions, belonging to a community, promoting healthy sleep habits. And all this is minimizing the adversity and act as a buffering factor to the dysbiosis happening from the early moments of life with the modern lifestyle. So at the MRN also, we are trying to foster a circular economy and how the production, recycling, and policy solutions can be a way forward to also promote environmental health. So translating planetary health is more than a transdisciplinary approach. It's actually also an integration of the social and educational paradigms together with research. So while societal change is already underway, we need to validate this with scientific theory and methods. To give you a taste of the research production that MRN members had been working on in mental health, integrating infectious diseases and how this can affect the mental health of people, place, and planet, or even how physical health is affected by the mental health. We also have some publications in public health, zoonosis, antimicrobial resistance, integration of traditional medicine, but also policy making in the issue of rare earth metals and how this can affect the global health as a whole. Also, we tackle religious worldviews, and in this article published in the ethics, values, and spirituality issue of the Challenges Journal, we also try to amplify the biocentric worldviews, infectious diseases, and adoption of evidence regarding vector-borne diseases, strategies to control certain arboviruses or even malaria and viral spillover. These are all sort of applications we have engaged in, and there are many others you can find in the website of the MRN. So the last item here that we are discussing is addressing barriers and enablers to advancing planetary health research. Again, this is your turn with a poll activity. Rate planetary health as a research approach. From 1, easiest, it's the easiest approach, or 5, the most difficult approach. So this depends on how you are understanding now the discipline of planetary health and your appetite. Are you going to engage with us in this kind of holistic approach, multidisciplinary approach, or is it really difficult for you? So let's also dive deeper to see the barriers and enablers to research using the planetary health thinking. This paper is about the urgent need for planetary health education for healthcare professionals and students in India. It's a commentary and it's very interesting to read further about the urgency in South Asia to adopt planetary health thinking and research to counteract the anthropogenic climate change and also the serious health consequences in that region. For healthcare professionals, also, we have dedicated programs amplifying the integration of planetary health in medicine. A growing human and planetary health movement in academia is already underway. So we hope that more of you join us in this space so that we can really implement some of your fresh perspectives. It's very interesting also to know that master's degree in planetary health taught in London School of Hygiene and Tropical Medicine as a module specification to navigate and to see if this one is for you, so that you can even have a more foundational learning on the evidence and translation for decision making in planetary health. So starting with the research barriers, first of all, we need to examine the researcher himself or herself, the researcher style. Because in this study, it's published in 2023, it was about the researcher preference, whether he is sort of learning by doing or he needs evidence first, whether he is prioritizing opportunism and pragmatism, or he's prioritizing to be more comprehensive and to secure himself first in the position of learning further. Is he epistemologically open to a new form of knowledge, or he's epistemologically sound and satisfied with the current things in academia? Whether he is real world events really matters to him, or he is just sticking to the academic well-known process as mainstream researcher. Whether he see planetary health as a messy process or he see it as a certain solutions-oriented kind of approach. So this kind of scale is very important first to ask yourself from the scale of 1 to 5. How do you see yourself? You see yourself as the researcher number 1, or you see yourself as a researcher number 2? So again, you can reflect on this in the chat box, and we will see how your understanding of planetary health takes you further. The research design. Is it about the difficulty in designing relationships like causation and correlation studies, or unpacking the complexity? And here I'm putting this example of the human health, animal health, environmental health, and all the disciplines at interplay. And this is actually really complex and multifaceted. But then the mentality and the mindset really matters if the researcher really is holistic in the way of thinking and like to unpack the complexity. And then again, here the design, it implies to assess the current state and trajectories, and also to envision alternative worldviews. And this depends again on the researcher and his capacity to read more and be more flexible in his thinking, and to design and evaluate solutions. So the planetary health paradigm, it really requires a solutions-oriented way of thinking. So I put this under the title of Planetary Health Research Barriers. I don't know if you agree with me or not, if the design itself can be a barrier or an enabler. Regarding the research themes, again, we have a lot to navigate, whether it is spatial dimension, global, regional, ecosystem type, subnational, community, or at a local level, temporal dimension, the present as cross-sectional study, historical as retrospective study, futuristic as projections or scenarios. And then we have the health outcome, all systems sustaining health and well-being, whether it is bio, psychosocial, or spiritual health. Then we have the health determinants, the exposome science to the environmental, economic, and political, as we illustrated in the very first beginning of this presentation. And then we have the health responses, healthcare system, how do they respond? The public health institutions, and then the community health. All these are simply some of the research themes that could impose barriers. We have also the evidence to policy translation, whether it is global, generalized knowledge, international norms, guidelines, new order, that we can propose evidence to policy translation, or regional development of policies, collaborative projects, national, crafting national policies, programs in health, economy, environment, or local, like grassroots initiatives, local interventions, context-based education. In all of these, the way in which stakeholders participate will vary at each step of the research process. And there are infinite options as to how to share decision making in each of these research tasks. So again, it depends on the skills. And when the early career researchers were asked about the challenges of this kind of integrative approach, they mentioned that it required convergence of interdisciplinary knowledge and actors. And also, data continuity is needed to address complex system level changes. And when it comes to climate change, actually, it affects people everywhere, but its impact and responses differ by community. And so we'll have climate deniers and climate approvals. This is something else that it depends on the community you are conducting the research in. And when asked what early career researchers need to address these challenges, they said, we need structured opportunities and incentives for interdisciplinary collaboration. We need mentorship and training in acquiring and utilizing long-term and large-scale databases. And we need networking platforms, funding, and facilitation training for engaging with community partners. And so the question here is about high quality case studies or retrospective analysis or secondary analysis of data, theory informed approaches or indigenous knowledge research or systematic review. All of these can be a way forward, but then we need first to confront ourselves with what do we need to address the planetary health challenges if we are really having this mindset that we are stewards of this earth and we can do a ripple effect of positive change. So to give you an example about the relationship between pathogens and planetary health, if we are going to focus on planetary drivers undermining the flourishing of certain pathogens, we can say it is just about wildlife use, agricultural use, climate change, or others. So when it comes to others, this is like an open frame and give us multiple check boxes that's really difficult to tackle. And even if we want to tackle the hotspots and the host of emerging infections, we can classify them as bacterial and viral infections. As we can see, the black square is for viral infection and the white circle is for bacterial infection. But then again, the probabilities are numerous here. And if you want to narrow them down to the link between antimicrobial resistance and how this kind of pathogens are flourishing, we have again multiple points to tackle, whether it is due to pollution of the antibiotic use in healthcare and how this spreads like resistant genes in the soil, water, and the food system chain, or is it due to climate change with extreme weather events, expansion of vectors, for example, and even how these vectors can transmit more disease? Or is it due to poor sanitation and waterborne infection that cause antimicrobial resistance? So again, it depends on the mindset and how we would like to focus on in our research. This is an invitation again that there are multiple journals actually honoring the role of early career researchers. For example, the Lancet Global Health, they issued this in 2023 about the role of early career researcher in the future of global health research. And they were inviting early career researchers to hold positions as guest editors and and be with them in the editorial board so that they can further cultivate more knowledge about the issues of global health. We have also, on the other hand, the role of early career researchers as reviewers. The IPCC, or the Intergovernmental Panel on Climate Change, it actually assessed the literature. So it doesn't conduct new research, and they also invited early career researchers to review the process of the reports and to engage with them in collaborative assessment of these reports, sharing their insights. And we can see in this map how low income country, lower middle income country, upper middle countries, and high income countries contributing. Again, broadly speaking, we will see the upper middle countries contributing more than the lower middle or the low income countries in this report. Yet, in this publication, they were drawing attention that opening the review process for early career researchers as a whole, this reduced the societal biases and also the prestige bias, the nationality bias, and the gender bias. So why planetary health matters to early career researchers? First, there are many opportunities for early career researchers, like the innovative research approach in areas with real world relevance, and while fostering collaboration with stakeholders from diverse sectors, as we elaborated previously. Also, building skills for success. Engaging in planetary health research help early career researchers to develop key skills such as scientific communication, writing, and peer reviewing of papers to improve the critical thinking and analytical abilities, and also interdisciplinary collaboration, working with professionals across fields to strengthen problem-solving capabilities, and to engage with stakeholders, collaborating with policymakers, communities to enhance the societal impact of research, and finally, to address even the barriers to planetary health research implementation, such as structured support system, mentorship programs, and offer opportunities to participate in global research collaboration that can empower them to overcome these barriers. So to recap, harvesting low-hanging fruits in planetary health research, it requires tools for conducting low-cost research like open database or surveys that tackle community-based methods, looking for grant and funding opportunities for early career researchers, which are many, and to build interdisciplinary collaborations across local and global platforms like Planetary Health Alliance, MRN, of course, you are all welcomed, and NOVA Network in the NOVA Institute also, and many, many others. So finally, to conclude, a broader vision of personal and planetary health flourishing recognizes the role of mutualistic collaborations with multi-solving strategies. Health professions have a moral obligation and should be aware of all factors of health, including our environment, to provide the most comprehensive care. Systems-based transdisciplinary approach of planetary health is holistic and demands local action with global relevance. So I hope the highlights of this webinar is to value our cross-disciplinary knowledge exchange and to honor our ancestral knowledge and indigenous traditions, and to stimulate a range of future research ideas and inspirations that help us make better sense of the world we live in. Finally, I hope you can share with us your learning moments, what resonated with you in today's presentation, any aha moments to share with us. We would really like to read your responses and comments. And finally, to acknowledge a big thank you to Talha for inviting me to speak at today's webinar and for the work he's doing with Russia. Appreciation to my institutions of learning And first and foremost, I thank God Almighty for granting me the beneficial knowledge and opportunity to share it with you all today. So here are the references for this talk and the publications and some of our conference presentations. All of these are on the website of the MRN. Thank you so much. It's really a pleasure and honor. And yeah, you have the feedback form. I would like really to hear your feedback after this talk. Thank you.
Thank you so much, Dr. Mona, for this amazing knowledge. And I hope that everyone present here will gain this knowledge and it will help them in the upcoming researches. I would like to ask them if anyone have any questions. So please, you can start asking your questions. So you can go ahead. And then I will be providing the form for the feedback. And I really request from everyone to write the full name because also we'll be issuing the certificates. So in order to do this, we need the correct information as well. So you can go ahead if anyone have any question, you can just type it or you can on your mics and speak.
So Ala, I have a suggestion that on the chat box we have a lot of contributions. So if you can go through them and see any of them, yeah.
Yeah, I think someone wrote. And let me check. So I think Mohaj, he said, can we even start doing research here in Egypt? We're still newbies and we definitely need a lot of monitoring in order for us to get our foot in the right direction. Who do we need to get in touch with?
Yes, of course, we can do a lot of research. And although planetary health as an approach is not really popular, um, we still have hope to amplify it first and foremost at the medical school, and then to take it through international conferences and to really build a foundation of the planetary health as a place-based approach to this kind of holistic paradigm. So you can reach out to me. I'm approachable. I'm available, and maybe Ala, you can share with them my email, and
Yes, sure.
I'd be really happy to hear from you.
Yes, for sure. Also, I want to mention, like, for of course, with the help of MRN, of course, with the help of Dr. Mona. Also, like, since Brasha, it's for students. Like, we are all students that we need help. For example, from people who is certified to do researches, like Dr. Mona and all these things. So I hope that you can visit our websites as well. Visit the website of mRNA, and you can see that there is how to reach for both of us, of course. I think there's one more question. Okay, I have a doubt. What would be the most part of research needed in order to maintain a good research?
Actually, we focus today on the value of research and how it really reflects real world problems. So I think that this is the next frontiers in research in general. Uh, the research that really make an impact with solutions oriented focus.
Okay, so there's another question. How can early career researchers effectively translate planetary health research into actionable policies or intervention that directly improve human health outcomes, especially in underserved communities?
Thank you so much, Habiballah. And actually, this is the idea of funding and the idea of open access database. We need to build on whatever available for us and to collaborate further regional, multi-regional, and across the global south as a whole. Uh, Optimism is there, but then the intuition and the mindsets is really sometimes what's making the process shallow, or sometimes even it can discontinue at certain phase. So it all begins with the individual passion, and actionable policies are doable, but then there has to be really evidence, as we elaborated in the slide, that this type of stepwise approach to try to convince policymakers is something that needs also skills and a lot of knowledge, you know. So I hope we can focus more on interventions that honor our heritage, our indigenous knowledge, and stood the test of time, you know, so that we can undo the dysbiosis and the things that really made an erosion at the societal level. Thanks, Habib.
Thank you so much. I think there's one more question from Fatima. She's saying that planetary health is a novel topic to many of us. What resources would you recommend to better advance our knowledge in this field?
That's a very interesting question, Fatima. And actually, I would like to say that Planetary Health Alliance is a consortium of, like an amalgamation of so many universities, institutions worldwide. They are offering educational material, and also they have sort of ambassadorship. I think Habibullah is also one of the West Africa ambassadors to Nigeria. So perhaps Habibullah, you can elaborate further on this idea of resources and its availability. So Planetary Health Alliance is just one example. We have also several others, like National Institute for Health. We have Planetary Health Paradigm.
RSTMH.
Yes, Habiballah.
Yeah, all right. Yeah, thank you so much, Doctor, for your wonderful and amazing presentations. And I couldn't take off my eyes from your presentations because there are so many gaps that was identified during the course of your presentations that one can actually venture into when you actually want to do research. Thank you so much for that. And a big thank you to the organization, student organization, for bringing this forth and a very insightful lecture. So to talk about what Dr. Mona asked me to do, there are actually so many opportunities for early career researcher, and one of which she mentioned was the Planetary Health Campus Ambassadorship Program by Planetary Health Alliance. So it comes out every last part of the year, which is I think December, October, August to October. So you can just apply, you share your idea, you share your perspective with regards to research, community-based research program you want to do in your community, or how do you want to advance planetary health, and you become an ambassador for your institutions. So I was a 2 times ambassador for my institution during my Bachelor of Pharmacy program. So it's actually worthwhile. And one of the advantages I had then was the opportunity to attend Planetary Alliance meeting in Malaysia, Kuala Lumpur. So it's part of the opportunity that I tend to meet with experts, which meet planetary experts, researchers, students, to foster more collaboration. So that's another one. Another one I can actually advise students to apply for is the RSTMH funding. We do say that early career researchers also need funding. So one which we can actually explore is the Royal Society for Tropical Medicine and Hygiene funding, which is a £5,000 funding scholarship for early career researchers. So, and I feel like the research, most of the funders, most of the beneficiary of this particular scholarship are mostly from maybe sub-Saharan Africa. So I can encourage students from North Africa to also apply for these fundings. And of course, if you have a very good proposal, and what I'm seeing from the chatbot, it seems as though a lot of students have keen interest. So you can also apply to those programs. So in addition to you keeping yourself abreast of the latest information on Planetary Alliance and Planetary Health perspective as a whole. Then I also want to add that the Planetary Alliance meeting for 2025 abstract call is out. So I will share the link in the chat box for individuals. You can go through it and you can make a submission. There are different themes for this for the abstract call, in which you can actually write a very beautiful abstract on. So that's actually another avenue to like improve your research regards to planetary health. So, and lastly, one of the things that most students don't actually take advantage of is abstract writing. Abstract is very, very important because if you want to start your research, as an early career researcher, if you want to start your research journey, one of the easiest way, even though very difficult, is very critical, and let me put it this way. Yeah, one of the most difficult, but still very easy, is to go through the abstract route. Check for abstract call and try to collaborate with your colleagues in class, that have similar interests, and see what you can come up with, and then write a 250 words. Abstract is usually not more than 300, 350 sometimes, so you can easily like come together to put something fantastic. So those are ways. So one of the ways by which you can start now is to like harness the opportunity presented by BAM 2025 that will be holding in Netherlands. So I'm going to share the link in the chat box, chat box now. Yeah, thank you so much.
Many thanks, Habibullah. And also, I would like to add the Nova Integration Hub. Whoever also interested in engaging more with thought leaders and scholars publishing in the paradigm of planetary health, food systems, and also societal well-being. The Nova Institute is having this kind of integrative hub. It's very easy to log in and to form like a profile and to engage more. And of course, the MRN is another space that we would like to welcome all of you. Our applications are going to open, inshallah, by the end of this year in December. And basically, we need your intuition, like a letter of intent why you want to join us in the MRN, about your previous experiences in research. But for the time being, you can follow us on socials, and also share with us even whenever you have any fresh idea about drafting manuscripts or anything like this. Of course, we would welcome you and also mentor you. This is part of our job to do, and we do it with so much open heart, and we really support you all through. So I wonder if we have any other questions.
I guess so far no, but just a second, let me check it again. Maybe I just didn't see one of the questions or something. Mohashi was asking again that, so are you suggesting that the health of the humans is interconnected to the health of the planet, and that's why we should do more research to focus on?
Exactly. This kind of interconnectedness is what's missing in our paradigms and our curriculum. We are really working in silos, especially in academia. And first, we need to have this mindset that why we need to connect dots to see the bigger picture.
I think that's all from my side in the chat meeting. Okay, so Talha is asking, as a medical student, how can I contribute to planetary health research in a way that directly impacts patient care or community health?
Thank you so much, Talha. And of course, you know that my background is in infectious diseases. So I would like to contribute with another example, not just the one that I illustrated in the presentation, about the food solutions, how food solutions can be very critical in the health and well-being of our patients and our communities. Um, as you know, ultra-processed food and industrialized food, GMOs, and all this is really undermining the overall health. And this is due to many factors. Actually, because of the use of energy dense and high caloric fat, which is even trans fat. It's not a sort of good energy that sustaining the body, you know. And also the lack of diversity in the diet, no vegetables, no fresh nutrients going inside the body. And so in this modern lifestyle, when junk food and ultra processed food and the shift from our nutrition, from the traditional way of eating to the modern way of consuming this kind of food is really something very critical that as physicians we need to approach with, you know, from the depth, from the tiniest part in our gut, the microbiome science. So this is to start with the diversity of the microbiome, which is the healthy gut bacteria, is something that is not in our curriculum, unfortunately. But then this gives us an estimation why the probiotic and prebiotics are really essential to health, and even why chronic diseases are fulminant nowadays, even seen in early age of life. So I would suggest that this is the simplest form of research you can start to write on, which is about the food security, the change in dietary habits, the absence of traditional food, and also how this is contributing to chronic diseases as non-communicable diseases, if we count them, like obesity, hypertension, cancer, cardiovascular diseases, and also mental health.
Thank you so much, Dr. Mona. I think there's one more questions are coming. So, okay, again, Muhaj is saying, we are starting clinical soon at my school. I think it's super important to see the struggles of the patient and how can I put my knowledge into action and research.
Okay, so first of all, we need to lead by example. I'm saying this because you cannot really convince your patients even to narrate more on the type of food they are eating, or the social determinants of health, the type of chronic stress they are exposed to, unless you are really convinced that these are undermining factors. These are like causes behind the causes. So first of all, I would like that you make the foundational knowledge for you more in a more deep way, so that you are really convinced with this kind of research that links the micro scale to the macro scale. And so you can then fit in the clinical conditions, the patient narration and everything in the clinical practice into this picture. Without the foundational knowledge and without reading more about how planetary health as a holistic paradigm can really magnify the molecular level first, for us as medical students and in the medical field, we will not be convinced enough to take it forward. Yeah, I don't know if this is convincing for you, but then this is how I see from the many cohorts attending the educational course I give in the integrated program. And when it comes to epigenetics, how the genes can be turned on and off, the expression of the genes can be really affected by environmental conditions, not by genetic influences only, as always highlighted in our main curriculum. So this requires much effort from our side to first grasp the whole knowledge about why we need to adopt this kind of planetary health thinking before applying it in practical in practice, you know.
Please let me check again if there is another question. Okay, so again here Muaj is asking, I like to focus on my patient as a whole and try to follow up with his prognosis and whatnot. If I'm to write a research or something, is that even possible, like a one at a time kind of case?
Okay, so perhaps even you can study the role of nutrients and how we are losing the essential nutrients in our daily food due to agricultural practices. So here you are linking the sector of agriculture to the food systems, to the medicine, and to the diseases. I'm just trying to rapidly connect dots and illustrate how different sectors can really help the medical sector and the healthcare system to flourish towards whole person well-being and so the societal well-being as a whole. Another example regarding mental health and how this can affect the physical health or the disease. Um, this draws back to how we see mental health as an organic problem or even as a heart disease. Like they say from Islamic perspective that there are diseases of the heart. Like if one is not really grateful, have a kind of um, views which are always negative. This is again reflected on the overall well-being of that individual. So mental health can be tackled in a lot of ways, whether the link to ultra-processed food and how the gut-brain axis can play a role. Okay, uh, but then it's so huge. So first, again, you have to read a lot. You have to make the foundational knowledge really more grounded so that you can take it upwards and elevate that to bring in your ideas and even solutions to the problems.
Thank you so much, Dr. Mana. I think that's all the questions for today. Okay, so I thank everyone for being here today, and I would request you to do again the feedback. Check it out and do the feedback, and also to visit our website, to visit our MRN website, Brash's website, and so that you will get beneficial information which you might search for it. Thank you so much, Dr. Mana, for joining us today. Thank you for having us as well. Thank you for your knowledge, and thanks for everyone. I hope everyone have a good day.
Thank you so much. It's really my pleasure and honor. And as I always say to encourage my fellow medical students, that all you need is just to unleash your potentials and to think outside of the box and to have more confidence in your vision and what you are doing. Without that, you'll be just like the mainstream thinking, doing research to put that in your CV and without having real world impact. So we are living in a very critical time, and the society really expects so much from us, and we are up to it. Uh, you have really got the potentials and the talents, but then the opportunities is up to you whether you embark on those opportunities or just you remain in your comfort zone and just focus on grades and for you this is just your world. So it depends on the mindset and how you would like uh, to examine the current world problems and contribute to it. Thank you so much for your precious time. And I'm really looking forward to more engagement with all of you, and take great care. And thank you, Ala, and thank you, Talha, for your kind invitation.
Thank you.
And thank you everyone for attending. It's really a pleasure. And let's keep engaging together on socials and so on so that we can advance with the ideas that we discussed today. Thank you.
I think it's not going to be the last time. Of course, we'll work again together. I would really like for others to join again in another presentation, another research with you.
God willing, inshallah. Thank you so much.
Inshallah, thank you. Have a good day, everyone. Goodbye.